Hungry Fish Media presents the new podcast On Mission. You know, we are all hungry and eager to help and do what we can during these uncertain times. But there are a few people going above and beyond doing exactly that in these extraordinary set of circumstances. Karen and I thought it would be the perfect time to launch a podcast featuring these amazing individuals and their stories. So friends, welcome to On Mission. Good morning, On Mission. Thanks for tuning in. We have a great guest with us today. We're so thankful she's with us, Dr. Janis Jones of Garfield Medical Center. We're blessed to have her, right?
Oh, yes. We go way back. We had our very first class in high school together, and we went through high school together. So it's been 20 years since we've seen each other. So it's what a blessing and so exciting to see you.
So we're excited to jump in with her and talk a little bit about COVID-19 and her experience with it. As you will learn pretty soon, she has a unique experience. Well, you know what? It's not that unique when we're talking about healthcare workers. But we're excited to hear her experience with it and a lot of other stuff. So welcome, Dr. Janis.
Thank you. Thank you guys for having me, for sure.
Awesome. So tell us a little bit about you and your family and what you do.
Okay. So I, like Kara said, we went to high school together. So it's been 20 years since high school. I'm actually from Africa. I was born in West Africa. My family immigrated to Seattle when I was about 9 years old and pretty much grew up in Seattle until graduating high school, then came down to California for undergrad experience, college life, apart from Seattle, which was like small town compared to LA, of course. And always wanted to be a physician. My mom actually had a stroke in high school, and that kind of opened my eyes to medicine and seeing her go through almost losing her to recovering and being fully independent from that. I wanted to essentially do the same thing for other families. And so that was kind of what drove me through the rigors of a medical pathway. You delay a lot of other things to pursue medicine. It's a full committed kind of a 12-year path of 4 years of college, 4 years of medical school, and then depending on what specialty you choose, it could be another 4 years or another 5 years plus. I chose anesthesiology. My personality is more kind of a quiet leader, but I like results. I like immediate results. I'm not a patient person. So anesthesia fit me perfectly. It was a combination of fully trusting, having the patient trust you, essentially. I'm doing everything that they would do for themselves except for their sleep. And so I put them to sleep and make sure that they are not feeling or experiencing any pain from the trauma of surgery, and walk families through kind of the pre, during, and post-procedure recovery. And then I move on to the next patient. So it's acuity as well as interventional and relational, just within the moment that we're dealing with, or I'm dealing with my patients and their families. I have two little girls, and I met my husband in college, and he's in the music industry. So we both knew staying in California would be our end goal and our long-term path. And we settled in Pasadena, which is about 20 minutes east of downtown LA. And we did long distance for medical school. After college, I went to Temple in Philadelphia, which was completely different lifestyle than the West Coast. But for regards to medicine, it was Temple is in North Philadelphia, which is predominantly African-American community and serves the underserved. So that went along directly with why I went into medicine and giving back and being exposed to the disadvantaged, the underserved, and wanting to give back in that sense. But at the same time, with medicine comes with loans for medical school and all of that. So you want to prioritize your career with what you know that you're passionate about, but also at the same time, think about your future with family and giving back and paying back Sally Mae. So
we know about that.
Right.
Anesthesiologists have a special place in our heart just from, what we had to deal with our daughter through her cancer treatment. And my grandfather was an anesthesiologist. So we're excited to have you.
I mean, by the end of it, we felt that they used to tell us, you're more likely to get into a car accident driving here than, something happening in anesthesia. And we actually really, truly believe that now, huh?
Okay, before we jump in any further, let's dive into the myth of redheads, and anesthesiology. Have you ever heard of anything like that?
Yes.
Is that true? Is there any truth to this?
Okay. There is truth to it. There is definitely truth to it.
Okay.
You didn't think there was?
No, I know. I always need more. And every time I've had any surgery, I've woken up and he just doesn't believe me.
The myth, or actually truth now, is that redheads need more anesthesiology.
Yeah.
Anesthesia. Mm-hmm. And so we're learning something new today.
Yep.
Yes. Well,
You've always known it.
Yes, but now you're learning something.
Okay. I learned something new today. Thank you for that, teacher.
You're welcome. You're welcome.
Thank you for ending his grandfather was anesthesiologist, and I asked him that question a long time ago. But he said before he would see anybody, everybody would have a cap on, so he never knew what color hair they would have.
Got it. Yeah, a lot has changed since then. With modern medicine, we try to make it more relational and personable, so that it's not just not a random, but a person that you see and you have no idea their name or who they are, and you let them put you under, and that's about it, So for our field, we definitely pride ourselves in making it a little bit more patient interactive and having a conversation and making sure a lot of it, there's a lot more to, you can benefit from a lot more of talking with the patient and laying fears rather than just throwing pharmaceuticals to everything.
Yeah.
Well, tell us, so I hear Carrie was telling me a little bit about you were quarantined because your exposure to COVID-19. Can you talk a little bit about that?
Yes. So I actually just shed my mask this past weekend, which I'm so thankful for, and my kids are excited about. And until my next exposure, I cannot have to wear a mask at home. At work when this all started, there were procedures in place and policies to definitely stop elective surgeries. And in a outpatient surgery center, that definitely happened. In most community hospitals, I would probably say that happened, but in my hospital, it did not. We reduced the amount of surgeries that happened. So we're probably doing 30 to 40% our normal case volumes. However, we are still doing surgeries. And so since this started, we've had a lot to kind of anticipate, but my motto is once I learned more about the virus and that it could be shed asymptomatically, that was a total game changer. Anybody can have it, and they would not know it. If they were symptomatic, that would be great because then we can cancel the procedure. However, if they were asymptomatic and just because of their exposure to someone at home or whatnot, they could bring it, and without protecting myself or protecting our staff in the OR, we would continue to spread it without even knowing that we did. So my particular case that I had the exposure to, this was a person under investigation. It wasn't someone that was confirmed. However, he exhibited symptoms that essentially I knew that he would be positive. It was just a matter of time of getting the test results back. And the surgery was an urgent surgery and needed to happen. And so I prepared my staff, and we went into it knowing that we had to be fully protected. We had appropriate PPE on. But even with that, you don't know, anything can happen. It's not a sure thing as not being exposed. And so with having a ex-premature baby at home, well, she's not a baby, she's now 2 years old, but an ex-preemie at home who has chronic lung issues and definitely would be at risk, I needed to essentially treat myself as if I was exposed and possibly could carry and shed symptoms or be an asymptomatic carrier to my family. And so I decided to maintain my mask at home. Normally, my normal decontamination procedure would be I go to work in my regular clothes, I change into scrubs at work. Between patients, I would change jackets and wash hands frivolously. I wear glasses normally, so I put goggles on top, and my PPE would be double gloving, a gown, mask, and because of the nature of my job, we place breathing tubes in patients, and this is a respiratory disease. And so once we go to place a breathing tube, we're essentially aerosolizing virus throughout the entire operating room if they are carriers or if they are symptomatic. And so through multiple kind of continuing medical education and watching or reading lots of articles and watching videos, I've kind of developed a way of maintaining and containing the virus within an enclosed space when intubating a patient, which is placing the breathing tube in, and maintaining that enclosure until the case is done, and removing the breathing tube within that enclosed space to keep everything contained as much as possible prior to removing the enclosed space and waking them up. So the decontamination process of coming home would be shedding my clothes again as soon as I enter the door, putting them in a bag, going straight to the shower. I would Clorox everything as I'm walking to the shower, come out, get dressed, and then interact with my family. Once I was exposed, I added another layer of that, and that was wearing my N95 mask at home until I went through typically you would see symptoms between days 5 and days 10 if you were shedding virus or shedding asymptomatically. And thankfully, I did not, and I felt comfortable removing it at day 12.
Day 12.
And did you, before the 4 of the days, like the first few days, were you wiping everything down when you were touching anything? Was that?
Definitely.
We've had Hunter's been the zero A to C, so we know what.
Yeah.
Like, you literally, you don't realize until like you realize you touched like so many things.
So at the beginning of when we first started, you said that, was it today or yesterday you shed your, what'd you say?
It was Saturday. Yeah, my mask.
What does that mean?
So that means that I was not wearing the mask 24/7 at home.
Your mask. Yeah. Mask. Okay, you shed your mask. I thought it was some technical term I never heard of.
No. So I was wearing
a new
mask.
Setting of the mask.
So your quarantine, self-quarantine, or whatever you want to call it, just ended.
Yep.
Wow.
And that probably included no touching or anything like that.
No kissing, no hugging. No, we would touch, but we would do like kind of like a forehead touch and a high five and side hugs.
So, tell us the real deal. Like in your hospital, I know you can only speak for your hospital, but is it as insane as what we hear on the news? Or are you guys being inundated, and are all the beds full? Like, just walk us through what you're experiencing at your hospital.
So I practice at 2 hospitals. My primary hospital, we are not inundated. We get daily reports as to how many patients are positive or under investigation, how many patients are in our ICUs. We are not overloaded with patients, thankfully. Like I said earlier, my hospital is serves primarily Chinese communities. So I feel like that actually helped us prepare more, because things happened in China a lot earlier than they came over to us. So if anything, they sort of knew inside knowledge as to what was going on there. So we have always had a good supply of PPE, a slow, steady flow of patients, but not to the situation of being at capacity. Now here in Pasadena, with regards to Huntington, I have colleagues who are at Huntington, and they had filled ICUs there. And as well as my other hospital that I practice at in downtown LA, California Hospital, the ICUs there were full, not at capacity, but pretty full as well in terms of patients.
And just so we're all clear, because a lot of people don't know what PPE is, believe it or not. Will you just tell us what that is?
So PPE stands for personal protective equipment. It can mean various things in different settings. In my setting, as stated earlier, because in my setting I aerosolize virus, we fully gown. So if you've seen images of when the Ebola virus was going around in Africa, there was a full kind of headgear, a white kind of tarmac suit, and booties, and it's called a PAPR. It's powered by a battery-powered fan that blows within and keeps giving you a flow of oxygen as well, but keeping you completely detached from the outside. So that's one extreme of PPE, and that's what we do in the operating rooms if we have a positive patient for sure that we are treating. Most hospitals only have about 3 or 4 of those. It's very, very limited to have a full PAPR. So we come down to the next level of personal protective equipment, which would be gloves, a gown, kind of a disposable plastic gown that you would wear over your clothes, and a N95 mask, because N95s are specific for particulate matter like the virus, to maintain that barrier of you being exposed to it, as opposed to a regular surgical mask or a cloth mask or a bandana or something like that with a physical barrier. But an N95 is made specifically, it has microparticles to prevent the virus from getting through. So in essence, your standard PPE for medical professional would be an N95 mask, a gown, and gloves, and preferably a face shield, actually.
So in the beginning, California was hit pretty hard. And then you guys kind of buckled down and put some really strict social distancing and other rules. And have those worked? How are you guys doing now?
I feel it has. We definitely are nowhere near what New York has experienced. Excuse me. In parts in LA County, that's where I feel like in Southern California, there's been the most patients impacted. However, in San Francisco and in, forget the city, is it Modesto? Some between Southern Cal and Northern Cal, there's an area that's more affected and heavily affected. But none of those areas have, like I said, are anywhere near what we've heard about and have seen, and I've personally in New York. And I think social distancing is a huge part of that, and acting quickly. I just shared an article that a colleague from Washington shared in one of our physician anesthesia moms group on Facebook. She's been giving us first-hand information from the UW and Harborview, and she shared a New Yorker article that kind of itemized the timeline of how things quickly happened in both Washington and California as opposed to New York, which was eye-opening actually to see how the responses were so different and the results from those responses, you know.
Yeah, maybe if you don't mind, you could send us that link. I would love to share.
I actually read it this morning. It's really good.
So I know Kara was telling me you want to advocate for healthcare workers. Tell me this: how important is it that the public adhere to the lockdown or whatever we want to call it? Like, if we don't adhere to these rules, does it put you at higher risk? Just talk a little bit about how important it is for us to follow the rules.
It definitely does. Initially, when social distancing was first getting the momentum, it was to not overload the healthcare system. It would be great if we had a steady flow of patients coming in, as opposed to a massive amount of patients that we couldn't be able to treat appropriately, and unfortunately have to turn people away or triage, in essence, of asymptomatic versus no symptoms versus mild symptoms versus needing full-on intensive care unit level of care. But if we look at it from the perspective of, if the public would continue to do social distancing, continue to wash hands, continue to make the decision as to doing what's relevant and essential versus not, it would be so helpful in helping us as healthcare workers, but in the end, helping us take care of the public, helping us be able to have enough supplies that would fully protect us and not have us question if we need to not go to work because we don't have adequate protective equipment, which is the case in some parts of the country. It's not. Fortunately, we're in an area that we have adequate supply, and I think it's a direct result of the social distancing, of the early interventions, and the stay-at-home orders still being adhered to and being enforced. Our governor here, as well as the governor in Washington and Oregon, are all kind of letting scientists kind of lead the way for what would be the safe way of returning back to life in essence, or returning slowly to the way that we carried about our daily functions, which I don't think that we will get back to that anytime soon, because it's already there's already talk about this recurring again during the next season. So it's definitely a new normal, and I think the lay public just being aware of the potential dangers of people definitely can share this asymptomatically. Having physical barriers in the essence of a mask is very helpful. Washing your hands is very helpful. Yeah, all of those things.
Well, in your opinion, like, I don't watch a lot of news.
Mhm.
We don't really even have cable, but I try to keep informed as best I can without driving myself crazy with all the news out there. But it for me, it seems like a lot of people, and myself included, feel like we're about to start getting back to normal. Is that not the case? Is that not the case? Are you telling me something different here, Doc?
No, well, it depends on your definition of normal. Is it taking your kids to school?
I guess that's probably the biggest thing for us. Is,
we're used to adapting to crazy life.
Right. Yes. I guess the biggest question I have right now, and I know it's probably difficult to answer because we're so far out, that are our kids going to be able to go back to school in September? Because this homeschool stuff is killing me.
I agree. Oh my gosh, I'm with you. I don't know. I pray and I hope so. I pray so.
You said praying's been your lifeline.
It has. It definitely has. It takes so much strength to go through the daily exhaustion of just the decontamination process that I described to you, and just guessing your thoughts of did I do that right? Did I do this? Did I do that? Having a routine and just executing that routine, but having the strength to do it, and then that's just work. That's just.
Because you have an immune compromise. If you have
exactly
your kid,
compromised kid, that makes it even. You're gonna definitely overthink it. Like,
well, how are you and your staff? The nurses, the aides. How is it affecting all of you guys?
We have great morale. We have great support. There was a period of time where not everyone was able to get the PPE that us as anesthesiologists had access to. And so we kind of along the lines of within the operating room, we're not aerosolizing everything for those who don't have protective equipment. So those who did not have an N95 mask, they would either be outside and wait, or myself personally, I did then closed intubations so as to minimize exposure of our staff to that. And it's amazing that I didn't think that what an effect it would have, but a lot of my staff were so grateful, so thankful that we were thinking of them in that aspect, and also at the same time advocating for them to get N95 masks so that they wouldn't feel like they were exposed or not protected. And so the morale has been great with our nurses and our staff. We support each other so well, and it's been very good so far.
Now, are you doing this interview with us from home?
I am. So my week started this week with me being off today. Again, like I said, with our case volume being low, we are not working as much as we normally work, and today was my day off because of that.
Oh, well, we certainly appreciate you taking the time on your day off to chat.
No problem. Homeschool's done, so.
Check that off the list.
Right, exactly.
Well, we really appreciate you and all your staff and all the medical professionals out there really going above and beyond during this time. You guys are definitely on mission, and you'll be in our little girls right here. What's up, girl? Say hi. Come say hi.
Hi. You are a warrior, my dear. You are my hero.
You'll definitely be in our thoughts and our prayers.
Yes.
Glad you're back, that you've taken off the mask, shedded the mask. Anything else? You got anything that you would like to share?
Yeah.
No, that's it. You guys just continue doing what you're doing. Be strong. I think my husband and I have been talking about this and everything that's happened so far. I think it's definitely coming out of this, we will have a stronger kinder society. I think the family unit is definitely going to be stronger. I've definitely already kind of noticed just with my girls and how close their relationship have gotten with the stay-at-home orders and playing together with the age difference of 6 and 2. It wouldn't normally be the case of interacting. So I think the family unit is definitely getting stronger, and just with people helping each other out and recognizing those who are in positions like our grocery workers, our postal workers, those people who essentially have to work. You know, not everybody is as fortunate to be able to stay at home or work from home. So I think it opened our eyes as a society to appreciate those people in our society a lot more kinder and thankful for the jobs that they do.
Amen to that. Well, God bless you. Thank you for all that you do. Give your staff a big air hug from
Well, thank you guys.
So good to see you.
and stay safe.
Stay safe, yes.
Okay.
Good to see you. Bye.
Thank you.
Bye.
Did you say bye?
Bye, Hunter.